Hi, everyone. This is Deidre Kindred, your nurse advocate, and I am here with my co partner, Shireen Miles, with Shireen Miles Professionals. And we are especially honored today to have Dr. Richard Young here talking with us during our health chats among friends. So, hi, Dr. Young.
Hey,
Hi,
Dr.
good to be with you.
Yes, yes. So, how's your day been so far?
It's been a work from home kind of a day.
Oh, good, good, good. And Shireen, how you been today?
Fabulous.
Awesome,
Not too
awesome.
hot. It's 91 in Texas, and that's a beautiful thing.
Yeah, yeah. I still need to wash my car, but I haven't had the chance to do that.
It's time for that.
Yeah. So, Dr. Young, tell us a little bit about yourself.
Sure, I'm a board certified family physician in Fort Worth, Texas, and I've been in practice for right at 30 years actually. And I created a completely new way for family docs to work with their patients and the billing system that goes with it. I'm located in Southwest Fort Worth and looking forward to telling people more about my model.
Well, I love your model.
I want to know more about your model.
Yes.
All right. Well, basically, I think that healthcare is too expensive. I think even primary care has gotten so bloated with all of the regulations and administrative burdens that, frankly, the government and insurance companies have put on them. So the patient sees maybe a receptionist and a nurse, but in the back office, there's an army of billing people and people arguing with pharmacies and on and on and on. And so there's tremendous overhead in primary care. And so what I've been able to do is create a model that strips out a lot of that overhead. And that way I can provide the same or better services at a much lower cost.
I think that's amazing.
That is good. And I imagine with COVID and under the current circumstances, with things running the way they are, that's something that's attractive to other physicians.
Well, I would like it to be. I created this payment system called Centira, and the website's www.centira, it's SENTIRE care.com. And I actually created it for any family doctor to be able to use.
Okay.
The challenge I've run into is all of these practices, even the so-called independent practices, because of the pressures from the insurance companies and hospital systems and all that, have basically had to create these huge administrative infrastructures around them. And frankly, what I allow to be charged under this model would have a hard time covering all that overhead. And so what I've decided to do is just go out on my own and use this platform that I developed for myself and sort of prove the concept. And then hopefully one day I can spread it to other family physicians.
Nice. So
I
how
can actually, oh,
long have you been doing that? I'm sorry, Deidre, go ahead.
okay. No, go ahead.
I was just going to ask, how long have you been doing this?
2 years now.
Okay.
Well, I'm actually a test patient.
Ah,
Did I
So I
pass?
can attest to it. The system is very easy to use. I had needed a physical, quick, fast, and in a hurry for another job. And I was able to log into his system, get him as my physician, of course. And he called me back right away within less than 24 hours, right? I believe it was like 24 hours. And he called me back the next day. That's amazing for
yeah.
the call back the next day. And it's usually you don't get the physician, you get the nurse practitioner or the MA or someone like that. And we were able to talk about some things in my personal health care. And he was able to give me some instruction and guidance. And it was amazing.
That's really good. And you know what it makes me think of is I actually was changing physicians during, well, it was supposed to be January. And so I had an appointment scheduled in March, late March, of course, that was canceled.
Right.
And so my intent was to go with this new physician that my daughter had seen. I thought, well, yeah, this is a good opportunity. It is now August and I still haven't been able to see her. And what they told me was that I needed to wait until something's wrong. So do you have a headache? Do you have some type of an ailment that we can use to bring you in?
Right, right.
With the opportunity to have someone that you can contact and be able to get the service that you need right away, that's massive.
So I started doing telehealth before COVID. That's always been part of my model, is that you're making a commitment to me and I'm making a commitment to you. And so that means I'm available nearly 24/7. Obviously there's times I'm tied up, but otherwise, yeah, I don't mind at all. Call, text, evenings, weekends, doesn't matter to me. I'm like most Americans, I got my phone close by and all I gotta do is hit pause on the TV and talk to you and fix you up, and then we hang up and I hit play and life goes on. And
That's my kind of doctor right there.
It's just not a big burden. And I have found out that probably 80% of my patients' needs, once I kind of get to know them and they get to know me, can be handled over the phone or with some text exchanges or that sort of thing. They don't have to leave their job or their family to come see me. They can spend 5 minutes on the phone and get their needs taken care of.
Wow. So are you able to also manage like school physicals and things like that are coming up? I know that's a challenge with schools.
Actually someone else was asking me about this. I think because of COVID, well, one, we're not sure that the schools are even going to have seasons. So there's that. And I believe some of the local school districts are being more flexible about that, meaning if you have like a physical from last year that's on file, then they'll take it because they know it's hard to get in because of the social distancing and that sort of a thing.
Sure. Yeah.
I'm sorry, Shereen.
Oh no, I was just wondering how that was going to work.
Right. We're just kind of up in the air with everything now. So you mentioned COVID, Dr. Young. So you were already doing the telehealth before.
Right.
Has it affected you at all in your navigating?
Not really. I mean, so I rent space from a great clinic called Total Care, which is on Grayberry Road in West Fort Worth. And of course, they've been very appropriately cautious about trying to limit traffic and that sort of a thing. And I've worked with them to figure out schedules that work. A lot of the COVID care that I've been delivering is more answering questions and then trying to guide people to some of the testing centers that have popped up.
Okay. Are you familiar with the testing center over there off of Southwest Fort Worth, Arc Point Labs?
Well, honestly, it's been a little hard to keep up with because, like TCU had one week and then it went away the next week, right? So there's all this confusion, and frankly, some of the websites out there do a pretty good job of letting people know what's available, and sometimes I'll just direct people to that. The CDC, of course, has changed its recommendations over the time, and so it depends a little bit on those sorts of factors. Available of in the early days, no one had any tests, and so they were real restrictive about who got it. So just trying to help people navigate all that. With really me just following my best understanding of the CDC guidelines, nothing crazy or fringe about it. The way I do all my testing, if somebody prefers to use me for something like this, is I have a contract with Quest Labs, and so you just go to a Quest diagnostic center, where they draw your blood and whatnot and get tested that way. But I just think there's a lot of these drive-through places probably are just as easy to use. And so I give people options however they want to do it.
Awesome.
What do you think that we can do to going forward? I know that's a lot of people's concerns is, what does this look like for the future? I mean, especially with, upcoming flu season. Every month that
Yeah.
that comes and goes,
Great question.
it's a new set of situations.
Yeah. Yeah, I'm just to be honest with you, I'm a little pessimistic about this actually. I mean, if there really can be a vaccine developed that works, it'll probably be January-ish of when it starts to become available. And then people start to get vaccinated, and then that will help drive it down. I actually think there's some data that places that were hit pretty hard, like New York area and Sweden, it might have actually run its course already, and there's not going to be a bounce back because enough people either already had immunity to it or got infected and then fought it off. But, there's a lot of unknowns to it. And so for sure it'll be with us through the fall. And frankly, listening to some of the media reports talking about, all the techniques to really drive down the rate, I mean, I totally get that. But on the other hand, where do they think the virus is going? Right? I mean, it's still going to be in the environment. And so I do worry that if a vaccine cannot be developed, and who knows, maybe it will, maybe it won't, but if it can't, it's just, I mean, people are going to ultimately be exposed to it. And then, then as you well know, there's a whole range of how people respond to it. And, I just do think we need to be a little humble as a country of what we control and what we can't control.
Oh, that is such a great point. I love that.
Yeah, it's a difficult time because the summertime, I think, is what exacerbated everything. People still want to be out doing what they do in the summer, and people are still getting sick. So it's crazy times.
It is crazy. It is crazy. But, if we put it on a historical lens, we're not anywhere close to the devastating impact of the Spanish flu 100 years ago. So I guess there's that little silver lining to all this. But yeah, if you don't mind, take it a slightly different direction. I mean, I know that economics have really hit people, right? Lots of people lost their jobs, lost their insurance from their job, that sort of a thing. That is exactly why I created this system. It's to make it more affordable for people who either don't have insurance or maybe they have a job where the insurance is weak, right? So it's a small business and they bought whatever they could afford. And so the trade-off is you have insurance, but it's one of these high deductible plans. And so it's, $3,000, $5,000, $12,000, of a family expenditures before any insurance money drops. And so I think one of the challenges for me in getting people to take a risk is they're so used to seeing their family doctor and throwing an insurance card on the desk and expecting a $20 copay, and they really have no idea what things really cost, right? Well, now under these high deductible plans, or even you lost your insurance, well, now you're going to get charged full freight on whatever it is that, services you need. And so one of my big challenges has been that most people have no idea what stuff costs in healthcare. And so, if I say, like I was talking to somebody this morning, actually, there was, if you're one of my patients, I do ask for a small yearly fee. It's basically $50 if you're over 30 and $30 if you're under 30.
Well, you owe me some money because I haven't reached 30 yet.
Every penny, Deidre.
I hear that a lot. Yeah, and when you sign up, then we cover your preventive needs. I mean, it's not just money going into a pot. You actually, it's a trigger for me to have that conversation with you. So we get you caught up on vaccinations or cholesterol testing or whatever you might need, okay? But after that, I charge roughly a third of what a place like CareNow or, one of these big hospital system clinics, right? The kind of the money that they charge, and there's examples on my website where I show actual bills from one of those big hospital systems versus what I would charge you. And so my example I used this morning was if I have a patient that, let's say, has really stable thyroid disease, right? And they take thyroid pills and they've been on the same dose for 10 years, they have no troubles, right? You could call me or text me. I'll ask you just a few questions to make sure everything's going okay. I'll electronically send in the prescription to whatever pharmacy you want, and I'll send you a bill for roughly $25, right? Because I didn't have to do very much, right? I mean, I didn't have to think a lot. Everything's stable, right? It does take me a little time to, do all the prescribing, and I have to write a note and my, medical record. I mean, I do have to do little work that the patient doesn't see, but to me, it ought to, the amount that I charge ought to match up the work. On the other hand, if somebody is just, melting down, they're having a horrible week and everything hurts, and they take, 10 chronic medications and, trying to sort through all that, well, I'm going to take everything that you want me to address and take the amount of time it takes to deal with it thoroughly. So yeah, we might spend 45 minutes together and maybe it's a $200 bill, but that's still about what CareNow would charge you for one visit, and they're just going to say, we will talk about one thing, right? What's your urgency? And that's all they want to hear about. And if you say, well, I also want to talk about something else, they say, well, we'd love to help you. Go back out, sign back in, pay us another fee, and then we'll talk about the next thing.
Yeah.
Right? I mean, they just aren't set up for these complex chronic conditions, which is a bread and butter of family medicine. And so, yeah, I will be much more thorough with that. Matter of fact, Sentira, the name of the platform I created, is an Italian word that means both to listen and to feel. And that's how I want people to come out of their time with me, is they feel like they're listened to and they feel like that I really cared for them.
I love that.
Yeah, that's awesome. What about a family? I
can take care of any age. I guess the only restriction that I can think of is on the upper end. If you turn 65 and you get Medicare, I really can't see it through this platform. Medicare makes it really hard to use any approach other than the Medicare codes and rules, and so I have to kind of bow out at that point.
I was going to just ask about Medicare and how that worked.
Yeah. So unfortunately, in theory, they could even arrest me
we don't
for
want
Medicare fraud if I tried to bill some. I don't know that it really happened, but on paper it couldn't. So I don't want to mess.
I don't even want to go there.
I don't. No. So your ideal client is someone who has subpar insurance, no insurance, only supplemental insurance, maybe fairly to moderately healthy, 1 or 2, 4,
I
5.
could have 10. No, really, it could be. There was a study done where it counted up that family physicians manage 1,600 symptoms and diagnoses. Okay, and I'm on that end. I mean, to me, that's one of the joys of practice, is to take people with lots of issues and try to work with them to sort out what's most important and what's fixable and what maybe isn't fixable and all that sort of stuff. So no, it does not matter one whit to me what your pre-existing conditions are. I don't expect people to be super healthy. Lots of people have, 1 or 2 chronic diseases, but if you've got 8 of them, that's okay. I'll still take care of you.
Awesome.
How can we help you? How can we help refer people to you?
So my website for my personal practice is it's basically drrichardAyoung.com. So drrichardAyoung.com. There's a place, I've got some testimonials for like actual real patients, talk about how I helped care for them. And at the bottom of the sheet, there's a place where if you're interested, there's a no obligation phone call or office visit that we can have. So if somebody wants to talk to me more, then I get basically you fill it out and hit the button and I get an email and I'll call you up or email you and we'll figure it out.
Okay.
Wow. Well, response time is awesome. He's very personable, very thorough, and very approachable. You know, some people say that their doctors talk to them this way up here, and he does not do that. So please reach out to him. Dr. Youngs, again, what is your website?
It's basically drrichardayoung.com.
Awesome. Awesome. Shireen, you have any more questions?
I
Lori?
think I am good. I'm looking at whether
Awesome.
I'm gonna check now to find out whether or not I have to get my son a physical.
Sounds good. I'd love to help.
Well, thank you so much for your time, and we really appreciate you. If you ever need anything, you know to call me.
Oh yeah, likewise. No, it's an honor. I really feel like I created something that can help a lot of people, but the healthcare industry has made it so hard for people. They get so disconnected from that one-on-one relationship, and frankly, having some sense of what things cost and what it ought to be, and they get bills in language they don't understand, and I've eliminated all that. But it's scary, right? I mean, it's hard for people to take that leap. And so, yeah, I just so appreciate you helping me spread the word.
Well, thank you. And Shireen, you have anything else you want to add before we close up?
I'm Shireen Miles Professional Services, your sales and marketing healthcare sales and marketing VP. So call me if you need help.
And she's
Alrighty.
awesome. And I'm Deidre Kindred. I'm a nurse advocate, educator, and navigator. So we love helping educate the community about the services that are out there. And there are many, many wonderful services. So we hope you guys join us next time. And thank you for tuning in to Health Chats Among Friends.
Thank you.
Bye.
Thank you.
Bye.